What does informed consent for lithium look like? My name is Dr. Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing. And I'm going through a series where each day I go through each of the most commonly prescribed psychiatric medications, and I go through an informed consent process as I would with one of my patients. And today we're talking about lithium, which is a big one. This informed consent conversation usually takes me quite a while. So buckle up. So lithium is one of, if not the most effective mood stabilizer that we have. And we don't exactly know how it works, but we know that it works really well. So lithium is a naturally occurring ion, and it is available over the counter in much smaller doses in lithium orotate formulations. But when we are prescribing it, it's going to be much higher doses, and that's going to be either lithium carbonate or lithium citrate. So when you're buying it over the counter, a lot of these risks don't apply or it's pretty negligible. But once we're getting to these higher prescribed doses, there can be some significant adverse effects or side effects that we have to monitor for. So common side effects include things like weight gain or change in appetite, GI upset, so that could be abdominal pain, nausea, vomiting, diarrhea. There can be increased thirst and urination. There can also be some neurologic symptoms like tremor or dizziness, fatigue. Occasionally, people can have dermatologic changes like hair thinning or a rash. There can sometimes be changes in taste or muscle weakness. And another significant side effect to monitor for is cognitive changes. Sometimes people experience brain fog, confusion, and it can contribute to delirium in people who are already cognitively impaired. As far as adverse effects that we need to monitor for, along with the weight gain, is going to be associated metabolic side effects. So things like increase in blood pressure, increase in cholesterol, increase in blood sugar. So just like the atypical antipsychotics, we do have to monitor annual labs for these things. So things like your complete blood count, your metabolic panel, your blood sugar, your cholesterol. But there are some additional things that we need to monitor with this as well. So one of the potential adverse effects is that over time, lithium can contribute to kidney damage and other kidney disease. And so that's one of the reasons that we measure your complete metabolic panel, because we look at the kidney function with that. But also sometimes people can have thyroid conditions related to their lithium use. So we have to check this both before and after we start the medication to see if there's any thyroid issue. It can also decrease the seizure threshold. Now, one of the things that we have to monitor really closely with lithium is the lithium level in your blood. And that's because lithium has a relatively narrow therapeutic index, which means that there's a relatively small amount of lithium that is helpful for that person and not harmful. So we generally recommend checking the level once every 6 months. And obviously, if it's too high or too low, we'll adjust to make sure it's in that therapeutic range. However, I will say I do not treat to the level, I treat to the patient. So if I have a patient who's doing really well on a super low dose of lithium, then I'm going to keep it at that low level. We don't need to increase it just to get to the therapeutic index. Of course, if something's high, it needs to go down. And that's because lithium toxicity can be really dangerous. So this might present as confusion, altered mental status, dizziness, difficulty with coordination. There can be vision changes, nausea, vomiting, all of that. And this can happen seemingly out of the blue because a lot of things can affect the metabolism of lithium. So lithium is filtered through the kidneys. So things that affect the functioning of the kidneys are going to affect the lithium level. So being dehydrated, taking certain blood pressure medications, taking NSAIDs, things like ibuprofen, naproxen, those can all increase your lithium level. Things that can decrease your lithium level include caffeine intake, excessive salt intake. Now, I should have gone over this earlier, but like I said, lithium is a mood stabilizer, which means that it's helpful in the treatment of bipolar disorder to both treat mania, keep the person stable, and treat depression. That's one of the reasons that it's really helpful is because it treats all three components of bipolar disorder. It is also independently FDA approved for SI, which means that sometimes you'll see patients who have treatment refractory depression or just SI, and they'll be treated with the lithium as well. Now, for uses that aren't related to mania or mood stabilization, you don't necessarily have to have as high of a level. So are there lots of risks to this medication? Yes. Are there a lot of potential rewards? Yes. So it's one of our medications that's more high risk, high reward. So it's really important that we go through all of these components of informed consent for lithium because it is a commitment to take the medication, to take it regularly, to monitor your intake of other things, and to get these routine screening labs. Additionally, like a lot of other psychotropic medications, it can be difficult to get off of lithium. We know that the risk of recurrence of illness is much higher if you stop the lithium abruptly than if you slowly taper off. So, of course, for each individual, we would go through the risks versus benefits for them, and we would make a shared decision based on that. If there are other medications that you want to hear me go through the informed consent process with, then put them in the comments below. Also, I'm putting together an email list for those of you who enjoy my content so that I can have more direct communication with you. I am not planning to spam you, but I may have future like offerings, resources, courses, and I want to be able to communicate directly. So if you're interested, then send me a DM with your email and I'll add it to the list. Wishing you all good mental health, and I'll see you in the next one.